What if I told you that there was a free, no extreme effort solution that you could use to not only downshift your stress levels, but you could boost your immune system, you could even improve your blood flow, you could lower blood pressure, you could even lose weight. What if I told you could do all of that with this simple exercise practice? And that is functional breathing. That's right. It's something that's just not taught in school. I mean, I don't know if you're like me, but nobody taught me when I was growing up as a kid how to breathe. If anything, they would tell you to take deep breaths through your mouth, which is the worst thing that you could do. Actually, if you go and you start learning more about breathing, and if you're a practiced yogi or yoga practitioner, you know how important breathing is and breath to movement. But when you learn about it, you learn also that things like breathing through your mouth actually increases stress. So why would you do that when you go through a heavy run or you're stressed out or your anxieties are high? Why would you breathe through the mouth then? Right? And so what I want to offer you in this short training is 3 different breathing methods that you can do to actually downshift stress, improve focus, boost your immune system, and even lose weight. Because what we often forget is there are 9 principles to fat loss, and one of those is air out of the body. Okay. And so some of us, we just keep breathing in short breaths all day long and accumulating excess oxygen in the body. So just imagine if you use breathing as a tool to actually lose weight. And there's a lot of studies to this. Actually, James Nestor wrote an awesome book called Breathe that actually talks through clinical practice studies of people using certain breathing methods to lose weight. I'm going to go through one simple one here and just see what happens. See what happens besides all the improved benefits that you get as well. So with that said, if you're new to this channel, my name is Troy Rice. I'm an integrative medicine practitioner and naturopath trained in several different disciplines, including functional medicine labs, brain health, and functional breathing. So without further ado, let's dive into that. Also, please check out the free guides below. One is breathing for weight loss. The other one is improving sleep and other factors of health. So everything I'm going to walk through today is actually linked below. Please access those free guides. Comment below. Try it out. Let me know how it's changing your life, because I leverage and coach so many of my clients to put functional breathing into their life, and just watch the transformation that happens. Okay, so here we go. First one, and I'm going to go through and demonstrate all of these on camera here so that we can walk through it. You can even pause and go through this with me and then try it out. Okay, so here we go. The first one, slowed breathing for focus. And this actually came from a book called Peak Mind. And so the author in there actually gave a study that she did with the military and how they could basically use 10 to 12 minutes of their day to regain back focus. And so what we often learn is like we get into a room and maybe we're daydreaming a lot, right? But what we forget is like the mind is set to wander 50% of your day. That means that several moments your mind is in this place of wandering, and that's okay. Your goal is to try to teach yourself to refocus it back. It's okay to mind wander, but then what do you do to bring it back? Or what do you do to tap into flow and actual focused work and not distractions, especially with how much we use our phones, right? I mean, have you looked at your screen time calculation on your phone lately and how many times you check it? Like it's such a huge distraction, and it just creates this, attention to nothing, right? And so let's dig into that right now. So this is what I want you to do, okay? You're going to find a quiet place. You're going to close your eyes, and you're going to place one hand on your heart, okay? And it could be your left, it could be your right. And then you're going to breathe in through the nose for a count of 4 seconds. And I want you, all of these practices, I want you to go really slow. So many of us actually go through our days where we take in breaths in, out. And really, if you slowed your breath down, like what if you actually only breathed in and out 8 times in a minute? And just think about how slow you'd have to breathe to reach that. Literally, you breathe in 1, 2, 3, 4, and then breathe out for 5 to 6. 1, 2, 3, 4, 5, 6. So that breath in and out took what, 10 seconds, maybe 11 seconds, right? So if you did that like 5 to 6 times in a minute, it'd be amazing, right? You're getting the right amount of oxygen, the right amount of CO2 in the bloodstream. You're calming your nervous system down. It's incredible, okay? So let's try this again. I want you to slow your breath down and think about it. Feel it. Like literally feel like no air coming in through the nose and almost no air felt going out of the nose or the mouth when you breathe out. So let's go slow. Let's do this together. Are you ready? Breathe in 1, 2, 3, 4. Breathe out 1, 2, 3, 4, 5, 6. Great. Now at the end there, if you're feeling a little bit fatigued or you feel like you need that extra breath, that's okay, because what you can do is improve what's called your BOLT score, your body oxygen level test score, and really be able to build up that tolerance, those breath holds, the amount of oxygen that you need for your body to run. And so if you feel that, I still want to encourage you that the next breath you take in, if you're not going to redo the 4 in and the 5 to 6 out, I want you to slowly take a normal breath in, right? A normal breath in of, and then a normal breath out, and then start again. And so that practice is incredible for downshifting stress, slowing your body down. I often recommend that first thing in the morning, especially if you're struggling with high blood pressure upon awakening, maybe high stress in your workday. So lean on that. Do that 5 to 10 minutes a night, 5 to 10 minutes a morning, throughout the day, whenever. Leverage that practice. Again, 4 in, 5 to 6 out, as slow as you can. Okay, let's go through the next one. Breath holds for vasodilation. Okay, so what you're going to do, again, find a quiet place, free of distractions, and you're going to breathe in through the nose for a slowed count of 5, and we're going to breathe out for a slowed count of 6. And then we're going to hold our breath. When we push all that air out at the end of the 6, we're going to hold our breath until air hunger. And if you're new to this, that air hunger could be 15 seconds, 20 seconds. And then it's going to get into 30, 45, 60 seconds or longer if you're trained. And so right now we'll practice maybe a little bit of a 20-second breath hold as we're going through this exercise, but I would encourage you to stretch that out. And then when you need air again, you're going to breathe in slow through the nose again for a count of 5 and blow out for a count of 6 and do it again. And try this breath hold exercises 2 to 3 times a day for 5 minutes. It is incredible. It'll help build up that BOLT or that body oxygen level test, okay? Improve several areas of health. I actually offer this one too for helping with sleep health too. So, and all of these will help improve sleep. I mean, a lot of times if you are somebody that snores, it's likely related to mouth breathing or chronic mouth breathing. And again, it's because we're not taught how to breathe. And so you have to retrain your body to breathe through your nose all day long, slow it down, and create that nasal cavity opening. Ignite that nitric oxide in the body. Did you know when you breathe through your nose, you also cleanse the air? You warm the air, you cleanse the air. Your lungs love it. Give your lungs the good air, not toxin air that's coming from the natural environments we live in today through the mouth directly to the lungs. Like, that is not what you want, okay? So there's so many benefits to this, but let's do this right now. Find that quiet place, no distractions, and I want you to breathe in through the nose for 1, 2, 3, 4, 5. Now breathe out. 1, 2, 3, 4, 5, 6. Now hold your breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, slow breath in. 1, 2, 3, 4, 5, 6. Slow breath out. 1, 2, 3, 4, 5, 6, 7. Hold your breath. You're doing great. All right, great, good. How do you feel? Right? Usually, when I teach functional breathing to clients, and they've not really focused any time on it, it feels amazing. Like when you slow your breath down, you can feel it. Like literally, you can feel your nervous system flip from any type of SNS, sympathetic nervous system state, to PNS, parasympathetic nervous system state. You can feel it in your body, in your blood. Like slow it down and you will feel the sensations. And just try that exercise for 5 minutes multiple times a day and improve your Bolt score. I'm going to include links in the guide too, where you can actually do other trainings like doing certain nasal breathing exercise while walking, while running, while exercising, and also improving your breathing score. Okay. So the one thing I didn't mention, because I do want to go through one more, which is breathing for weight loss. One thing I want to mention is the first exercise we did. You can leverage that type of breathing in a type of meditation to help with focus. Okay. And what that looks like is when you are thinking and focusing on your breathing, it's very hard for you to have a racing mind and having a ton of thoughts come in while you're sitting with your eyes closed. And so focus means you're doing that. And after you get like 2, 3, 5, 10 minutes in, you're going to naturally, thoughts are going to fly in, right? About your day, the things you have to do, projects you're working on. Maybe it's things you got to get done around the house. Maybe it's a grocery list. What you're going to do is you're going to recognize those thoughts flying in, and you're going to bring it back to your breath and count again. And you're going to do that for 10 to 12 minutes straight. Okay. And that's where the 12-minute exercise comes from the book Peak Mind, is we know thoughts are going to come in. It's retraining the mind to say, hey, I see you thoughts, or I hear you, but I'm going to focus on my breath and bring it back in. Okay. So I wanted to call out that piece before we jump into breathing for weight loss. And so this is so fascinating, right? Because I've had several clients, of course, we go through the 9 principles of fat loss, which I can also link up here below, where it's certain things around, calories in, calories out, in some aspects. Like it's not the be all end all, okay? Fasting, intermittent and prolonged fasting, balanced nutrition and making sure that you're getting that right, okay? Managing your stress levels, very difficult to lose weight when you have high cortisol in the body, okay? And then insulin as well, so we do different insulin tricks. But I also say, did you know you can do breathing for weight loss? And they're baffled, right? And so maybe you are too. So I want to walk through this because there is something to be said about too much oxygen in the body. And so if you can push out that oxygen in the body, you can actually lose weight, okay? So let's talk about what that looks like and how you can do that, okay? So here we go. Find a quiet place. You can close your eyes just like the last few. I want you to place your hands below your rib cage on the left and right. So we didn't talk about this first time. The first one we did over the heart. That's more of like a heart meditation focus. But your diaphragm is down below, your rib area there, and it's on the left and the right. And so what we talk about when we do diaphragmatic breathing, or maybe you've heard of belly breathing, what we do is we put our hands there because you should feel your diaphragm move east to west. In other words, it's expanding outward, not up, because a lot of us learn to breathe, and like when we breathe through our chest, we feel our chest lift. And that's not how you want to breathe, right? We're not breathing through our lungs. You want to breathe through your diaphragm, okay? So you can put your hands down there, right below your left and right rib, and you're going to go through this practice, okay? So here we go. You're going to take a slow breath in of 4, and then we're going to take a slow breath out all the way until we got nothing left. And then we're going to squeeze all the air we got out. Like literally, like if you were to like grab, I don't know, a stress ball or something, you're going to squeeze it. We're going to actually squeeze our body like we're pushing all the air out of our body, okay? And so this is what it will look and feel like. So this is what I want you to do. You're going to go through this with me at least once, right? So here we go. Take a normal breath in through the nose for a count of 4. 1, 2, 3, 4. And then breathing out. 1, 2, 3, 4. Keep going. 5, 6, 7, 8. You should feel it start to lengthen, get less. Now squeeze all that air out. Keep breathing. Squeeze all that air out. You can feel your stomach muscles getting tight and your diaphragm muscles, they're getting tight. You can feel everything getting tight. Now take a normal breath in through the nose and a normal breath out through the mouth or nose. Excellent. So that's exactly what you're going to do, okay? And I want you to practice that for 5 to 10 minutes. Do it multiple times a day if you want. But again, the goal is 4 breaths in, 7 to 8 likely breaths out until you feel there's nothing left. And then you're going to squeeze so tight, get all that air out. And then don't take a huge deep breath in and fill the lungs back up. What I want you to do is take a slow breath in for the count of 4 and do it again and work on that. You're going to feel it. You're going to feel the sensation. You're going to reset, okay? And the best way that you want to come out of this particular practice is not go back to a normal lifestyle of breathing in, out, breathe in, out. That's what we do at our desks all day, right? And I'm saying desks, I'm sitting here, right, teaching this. So what we want you to do actually is get out of all of those practices, especially this one, and be mindful of your breathing all day. So now you're back to your normal task. I want you to think about it. Slow your breath down. Breathe in through the nose, not the mouth, and breathe out through the nose or mouth. And just think about that, okay? Use these practices. When I talked about, morning, evening, at lunchtime, the downshift stress, whenever you want, you could do it in the car. Like the only difference is please do not close your eyes, okay? And so, but you can absolutely do these breathing exercises in the car, right? Where you're breathing and you're squeezing the air out. At least think about nasal breathing to slow it down. So inside the Breathing for Weight Loss guide below is the 9 principles of fat loss. Please take a look at those, especially if you're somebody that's looking to lose weight. A lot of times we talk about weight loss, but literally it's fat loss, right? The expansion and the shrinking of fat cell tissues, okay? And so if you're looking for more on that, I've done a ton of videos on how to reduce, weight loss through fat loss, how to shrink fat cell tissue. So please go and check those out. But hopefully you found this helpful. I'm going to do more of these types of videos inside our Wellness Mavericks community where we'll be doing structured breathing trainings like breathing for panic attacks or anxiety. And so maybe I'll drop the link down below if you want to check that out as well. But more videos like this to come. So thanks for joining me today. Hope that was helpful. And remember, breathe through your nose. I'll see you next time.